Want to know what all of these jars have in common? Joint pain. They can be someone's worst nightmare if they have pain in their hands. So today we're going to talk about some of the things that you can do to relieve the pain in your finger joints. Stick with me till the end and you might just be feeling a little bit better before the video is over. If you're new to this channel, welcome. Please make sure that you hit that subscribe button and notification bell so that you are notified anytime that we are releasing new content at least once a week. And my name is Dr. Brandy Rose Lipscomb. I'm a naturopathic physician, pain relief specialist, and today we're going to talk about the two most common types of arthritis that we develop in our finger joints and some of the things that we can do about it. First, to understand the arthritis, we need to understand anatomy and a few different terms. So the name for the bones of our fingers and our toes is a really funny name. It's called the phalanges. These are your phalanges. And we talk about in medical terms something being distal, meaning it's further away from the heart, or proximal, meaning it's closer to the heart. So with our finger joints, we have the distal interphalanges, or dips, and proximal interphalangeals, or pips. So dips and pips. We also have our metacarpophalangeal joints, or MCPs. So you have to bear with me. I know that's a little bit of anatomy, but it's really helpful when we go to talk about these different types of arthritis that can occur in the hands. So our tendons that come from our forearms to help our fingers extend and flex they come through multiple joints, and so they have to be anchored down at each joint by little fibrous sheaths so that they function properly. And we have annular sheaths that sort of just clamp down on the joint space, and then we have cruciform sheaths that make kind of an X or a cross. The annular ones are a little bit stronger. At any rate, the tendons have a synovial membrane that they are encased in to make them a little bit more slippery and able to slide through those fibrous sheaths so that your finger can do this. Pretty amazing, right? Anyone who doesn't think that we are wonderfully made did not go to medical school, in my humble opinion. So let's review the two different types of arthritis that commonly occur in the fingers. The first one is osteoarthritis, and I might refer to it as OA throughout this video. OA is the type of arthritis that's developed slowly over time in response to mechanical wear and tear. And I don't know if you guys can hear the birds out there, but I'm just going with it anyways. So OA occurs, we get little nodes, bony nodes. We can get Heberden's nodes up here on our dips, and we can get Bouchard's nodes on the pips. What happens is that you've worn down the cartilage in these little dips and pips over time, and the bone has responded by trying to kind of grow and protect itself. And the process of forming that node can be really painful. Usually after a year or so, once that node has been formed, then the node itself is fairly painless, but it can leave you with these crooked fingers that are then, not as strong, and it causes pain when you're trying to grip things and do things. And treatments for osteoarthritis typically start with non-steroidal anti-inflammatories, which we've already talked about those a bit, and hopefully referral to physical therapy to see a hand specialist. And then if that's not working, maybe they're going to inject you with some steroids, which we already have a video out about that as well that you can check out. And then if that's not working, sometimes their surgery is necessary in order to help those hands function. We use our hands all day long, right? What would we do without our hands? The less common type of arthritis, about 1 in 10 cases of arthritic joints in the hands, is rheumatoid arthritis. Rheumatoid arthritis is an entirely different beast. It's an autoimmune condition. It means that your body has developed its own antibodies that are attacking the synovial membrane that is there protecting those tendons in the hands. And so with rheumatoid arthritis, we typically see that it can progress much faster. Often symptoms come up within weeks to months. Rheumatoid arthritis most commonly occurs in your PIPs and your MCPs. So if it's the pinky pip, it's also the other pinky pip. It's everything is bilateral, the exact same joint for joint, typically in rheumatoid arthritis. And because rheumatoid arthritis attacks the synovial membranes and the tendons themselves, we tend to see more deformities called a boutonniere's deformity or a swan neck deformity, where there's weakness in the tendon in one area and then it's kind of tensed up in the other. So it's a really different ball game, more of like an up-down kind of pattern than the crooked pattern that we typically see with osteoarthritis. You can have nodes on the fingers with rheumatoid arthritis. They're called rheumatoid nodules, and they definitely look a little bit different in person and on x-ray than the nodes that we see with osteoarthritis. And the earlier rheumatoid arthritis is diagnosed and managed, the better. This is a systemic condition that is perhaps the best approach is a combination of pharmaceutical therapies. There's some amazing drugs that have come out these days, as well as topical pain relievers, natural anti-inflammatories, addressing your gut health, and even looking at your emotional health. There's some studies that are coming out where they're looking at, yes, people with rheumatoid arthritis tend to have more depression, but is it possible that people with depression have a higher risk of developing rheumatoid arthritis? What are you saying to yourself about who you are and how you feel and how you function in this world? If it's not the most positive, wonderful, loving thing that you can possibly say to yourself, you need to check yourself and you need to work on correcting that message to one of complete love for yourself. You need to love yourself more than anybody else on the planet. But that's not what I'm here to talk about today. So if you think that you have like early stage osteoarthritis, your fingers are a little bit swollen, sore, one of the things that you can do at home that might help is long axis traction. And what that means is working along the line of the joint. So grab that finger and pull long axis traction. That noise, that little pop noise that you might hear in my fingers, there you go, is actually the release of trapped vapor bubbles within the synovial fluid. And it sounds really loud to be a little tiny vapor bubble that is turning back into more synovial fluid, but that's exactly what's happening. The synovial fluid in the joint can be under so much pressure from all the compression, from all the stuff we do with our hands all day, that the fluid can turn into more of a vaporous gaseous state. And so that is actually the release of gas turning back into a liquid form. So we're kind of bathing that joint a bit more in synovial fluid. But for the record, the studies have shown that people who like to crack their knuckles are mainly just annoying everyone else around them, and they're not actually causing arthritis to their hands. That's right, there's been a couple studies that have looked at that myth that cracking your knuckles causes arthritis, and much to my dismay, it has been debunked. And also for the record, studies have shown that people who crack their knuckles like that all the time tend to have weaker grip strength over time. So there you go. If there's one reason to not crack your knuckles other than you annoy everybody in the room, it's because you don't want to shake hands like a wimp. And the next trick is a little bit easier if you have someone at home who can help you, but you can kind of do this on your own. And it's all about bathing these joints in synovial fluid. So you know how it feels really good if you move a joint and it's spiral flow, clockwise, counterclockwise. And we can do that with so many joints in our bodies. We can roll our necks, we can roll our hips and our knees. But it's really hard to roll your fingers, right? So we can increase the synovial fluid in our fingers, or the circulation of the synovial fluid, by stabilizing one of the bones that make up the joint and then moving the other one in a clockwise fashion, and then in a counterclockwise fashion, and then just give a little bit of, I call it lateral translation, just a little bit of back and forth, up and down. And you can do that with all of your fingers, where you sort of work them around in circles and side to side gently. If it hurts, don't do it, or do it really gently until you start to, and if you hear Rice Krispies in there, you're breaking up some of the little calcifications, some of the little bony spiculations that have occurred in that joint space. So that is just one of the other ways. In addition to long axis traction, you can really kind of get into that joint and feel those bones and just work it side to side a little bit, give it some little circles and encourage it, give it the opportunity to try to release a little bit so that your fingers move a little bit more freely. I mean, we use these things all day long, right? So a little decompression at the end of the day, a little love for them can sometimes go a long way. But if you have pain that is more severe and you're looking at me going, that's all you got, doc? That's not all I got. I've got these. What are these? These are conductive electrode gloves that have silver fibers woven into them so that they conduct electrical waveforms, meaning that that amazing waveform that I've talked about with the First TX with our dynamic neuromodulation device, that waveform can be transmitted through these gloves. We simply hook up the little white parts to the electrode lead wires that come with the device and attach the wire to the device, turn it on, select which mode that you want, whether it's acute or chronic or somewhere in between, and you can run the current through the gloves. Now, for them to work best, they do best when they're slightly damp. So I'd like to encourage my clients to make a little witch's brew, if you will, to make a solution with some Epsom salts or Himalayan salts because of the magnesium and the trace minerals that can be in that saltwater solution, and even to put a couple drops of an anti-inflammatory essential oil into the mix, because this electrical signal increases iontophoresis. Iontophoresis is our ability to absorb nutrients through our skin. So you can give yourself a mineral-rich, anti-inflammatory treatment while you sit there and binge watch Netflix or watch YouTube videos. So this is one of my favorite treatments for people with arthritis who, you know, want something to do to relieve their pain at night after a hard day's work. Is this going to completely reverse your arthritis and magically straighten out your fingers and give you the hands of a 20-year-old? No, it's not. But if you could do something that was amazingly relieving to your hands and it felt good, and you could do it after a hard day's work while you're sitting in the comfort of your home, would it be worth it? And if someone could also apply a pair of like medical gloves, like latex gloves or nitrile gloves, and then put these on and give you a shoulder rub that had some electrical current coming into it and put you into that super relaxed, lovely state, would that be worth it? I mean, I love it when I find an item that has multiple different benefits in my life. So if you're interested in learning more about our program for pain relief for the home users, you can go to the My Pain Eraser and Rapid Recovery link. And if you're a health professional who's curious about how you can take this technology and improve outcomes for your clients and have more fun in your practice, then click on the Painless Prosperity link below. And if you're interested in learning more about the harmful effects of corticosteroids and why this might be a better option before you get that injection, check out this video next. And if you want to learn more about this technology and how dynamic neuromodulation can outperform traditional TENS, you gotta check out this video. Thanks again for watching, sending you optimal happiness and health and so much love. We'll see you next time.